So it's my absolute pleasure to talk today with Joe Sardano. Joe is the CEO, the chairman, and the founder, one of the main founders of Sensus Healthcare. And Sensus has been a partner with dermatology for the last number of years in many ways, has brought superficial radiation therapy back to dermatology after many years. Which allows dermatologists to really give the gamut of treatments for skin cancers and recurrent keloid scars. And it's really a pleasure to see you here today, Joe.
Thank you, Dr. Nestor. I really appreciate it. It's a pleasure of mine to be here in front of you.
Great. So I want to start off right away because I think we've had some very exciting changes recently with acceptance. And Astro has been one of the main, agencies working against the idea of dermatology treating patients with superficial radiation therapy. And they came out recently and they talked about the use of radiation therapy for skin cancer. And I think that having this acceptance, and of course through the work of the dermatologists as well as Sensus, much more respect and much more incorporation of this in the body knowledge of dermatology. How do you see this change reflecting in the ability of dermatologists to expand the use of radiation therapy in their offices?
Well, 2 years after the consensus publication by yourself and many other physicians talking about SRT, Astro finally came around with their own consensus on radiotherapy and superficial radiation therapy, saying that it is a primary treatment for skin cancer patients. So we're very appreciative with the recognition of the fact that 10 years of hard work, which really was supported by yourself and many other physicians to help us get here, it was very satisfying to see that finally they recognized that SRT is a valuable tool in the doctor's toolbox to treat patients with skin cancer. So I think it's a long time coming. It's never too late to get the right things done. So we're excited for what it offers us with our dermatology physicians and our dermatology community, especially with the compounding problems that we've had with COVID. I think a lot of things are coming to realization, especially with a lot of the work that we've been doing with CMS as well. So we're excited for the future, and we're excited to get the word out on training, educating, and helping physicians understand why SRT should be part of their practice and how it can help them and their patients.
You brought up the second thing, and I just want to take a moment to reflect on how hard Sensus has worked on behalf of dermatologists over the last number of years. And I've been a visitor and really a part of watching you work so hard behind the scenes with CMS to increase reimbursement for something that is absolutely needed. And everybody recognizes that SRT has been very much undervalued. And it looks like hopefully this is the year. And this is the year, despite the fact that we're seeing cuts across the board in dermatology services and Mohs and dermatopathology. And aside from thanking you, I want to see what your thoughts are going to be for some increases in badly needed reimbursement for SRT coming in 2021.
Well, as you are aware, we've been involved in this production and this initiative since 2014, when we were allowed to directly get ourselves involved with CMS, where interested third parties were allowed to go directly to CMS rather than having to go through the societies or the AMA, which had been the traditional way of approaching it the previous 20 to 30 years. And so we recognize the fact that doctors work very, very hard to provide patients with the treatments that the patients really need. And we saw that in the instance of skin cancer treatment, the doctors had to work even harder when it came to radiation, because it wasn't something that had been made available to the doctors in recent years, but it was a time-honored tradition for dermatologists to use superficial radiation therapy dating back to 1906. And so we're trying to bring this full circle back to the doctors to put it in their hands. And we recognize the fact that with the hard work that they're providing to treat these patients and to cure them of skin cancer, they certainly deserved to be paid more money than what was being paid at the time. And sure enough, we found some holes in the project where by statute, this reimbursement had to be reconsidered every 5 years, and it had not been done since 2002. And that's because really nobody ever had any technology to bring to the forefront or to talk about it. So a lot of the money that we made in selling our products were reinvested into lobbying efforts, into consulting efforts, into going back to the CMS to help them understand that we had a technology that was coming into this space that they need to keep reimbursing, and not only reimburse, but also to increase the reimbursement because of the statutes that had been bypassed in the past. So here we are 7 years later after our strategic initiative started, millions of dollars later, and we're at the point where we're going to see some very strong results as a positive for physicians who want to treat superficial patients, skin cancer patients with superficial radiation therapy. And I think it's coming at a very opportune time. The timing couldn't be better. We wish that it would have happened years ago. It would have cost us a whole lot less, but at least it's coming now. And COVID has really made this more apparent on how important SRT really is, because one of the statements that I made during an earnings call after our first quarter was the SRT machine was literally the last machine that was turned off by a Mohs surgeon or a dermatologist that had SRT before closing their doors for COVID. And when they reopened several months later, it was the first machine that they turned back on. And when you look at the overall patient population and the profile of the patients, they have the exact same profile. The COVID patient has the exact same profile as the skin cancer patient. They're usually over 65 years old. They have pre-existing conditions. They're usually diabetics. They have beta blockers because of heart conditions, have hypertension. All of these things are the exact same profile. So we think that now with social distancing and with the advent of being more concerned of having patients close by together, or having patients that might have be cut on with Mohs surgery and things like that, this is a tool that's going to help those patients, as well as the surgeons, as well as the non-surgeons, be able to treat their patients in a very responsible way, especially with those high-risk patients that we know of today that are equivalent to COVID and to SRT.
No, I agree with that. And I think we've experienced this as well, because it's very easy to follow CDC guidelines with cleaning the rooms, the equipment, and having patients come in for the treatment. So I think this has been very positive. On another note, Sensus has expanded. I know it's been announced that Sensus has acquired 2 mobile aesthetic laser companies, and I understand this is just the beginning. So I'll let you wrap up with talking about the future of this, as well as the future of expansion of Sensus.
Well, thanks for bringing it up, but we're very excited for this business opportunity, and we're very excited for the opportunity that we had in acquiring these 2 companies. These companies, one of them has been in business for 21 years. The other one has been in business for 17 years. Very reliable people, very strong business sense, and extremely have high integrity with the physician population that they serve, in being trustworthy and being on time all the time, and providing a tremendous service to them and their patients when they need it. With the advent of us bringing on our own lasers towards the end of the year, as we go through an FDA process to get these lasers cleared, we can add these lasers, our own lasers, to this process. And the biggest opportunity that we have, of course, is with our Sentinel, our IT solutions piece. But the opportunity to serve patients or to serve doctors on a rental basis, whether it be a daily rental, a weekly rental, a monthly, or a yearly, or even multiple years, these are the great opportunities that we have. And I think, again, because of COVID, a lot of the physicians are saying, I've got so many lasers here, what do I need all of them for? Do I need to buy more? Do I need to buy less? Or do I only need them to use them when I have my patients here? I think we can provide a schedule and a service, an asset management program that's going to ensure our doctors that they have the exact tool that they need anytime they need it, whenever they need it, all the time, without having direct ownership. And I think that that's going to relieve them a lot of financial burdens and be able to go after the opportunities that they have for the patients that they treat for these different conditions and with the different indications that these multiple lasers could have. How many years have we gone through this where we walk into a dermatologist's office and not only do you see a lot of lasers, it's almost like it's a graveyard for lasers. These lasers are sitting in rooms and they're not being used. Well, you know what? Let's put them to use. Let's make them money. Let's put everybody together and have like a co-op where we can drive all of these lasers into the offices where no one will ever have to buy a laser again.
Listen, I think that, as you said, the timing is everything. I think that physicians have faced a number of months with decreased revenues. This comes at an incredibly critical time because we really want to expand what we're doing for our patients. But I don't think there's a lot of money out there to necessarily buy a lot of lasers and a lot of equipment. So I want to applaud you on your vision and how you're looking to expand services into the dermatology offices.
We're very interested in making sure our physicians are successful. We understand the business model, and we want every one of our physicians that we deal with to do very, very well.
So I want to end by saying thank you. I think that throughout this crisis, certain companies have stood there with their physicians. There have been a lot of WebExes that you have done throughout this time, talking about opening a practice safely under COVID, talking about how to maximize the safe treatment of patients, and you have done that throughout. And I want to applaud you because you didn't have to do that. You did it for your customers and for dermatologists as a whole. So thank you, Joe. I thank you and for Sensus. And as a community of dermatologists, we look forward to the growth of Sensus and the partnership that has been so vital to dermatology over the last few years, and will continue in the future. So thank you, Joe.
Dr. Nestor, thank you. And as you know, the South Beach Symposium was where we signed off before COVID hit. I want it to be the first thing that we go into in the new year with everything behind us so that we can resume where we started off.
We all want that without question. So thank you so much, Joe.
Thank you. Appreciate it. Thank you.
Thank you.